demonstrated that rosuvastatin compared to placebo reduced cardiovascular events in all, and blood pressure lowering was only effective in those with the highest blood pressure at baseline. In this subset of the population, what we found, we measured cognitive and functional outcomes at baseline and study end, and found that for blood pressure lowering compared to placebo, there was no difference in the amount of cognitive decline. For rosuvastatin compared to placebo, there was no difference between the groups in the amount of cognitive decline, and the combination did not have an effect either. Statins have been associated with adverse cognitive effects, episodic memory loss actually, that is reversible upon discontinuation of statin use. These were data from observational databases. The randomized controlled trials never saw the same results in terms of any effect on cognition of statins, and these data support the fact that rosuvastatin is safe in terms of cognitive decline. There was no excess. Earlier this year, a publication in Lancet called for that, and we think that as we accumulate more data, the regulators need to take a look at this because it does affect the patient's perception of the drug. So although you may be preventing a cardiovascular event, people are very afraid of cognitive decline, and it might stop people from taking very effective medications for the wrong reasons. We went back and looked at the subgroups, in particular based on baseline systolic blood pressure. What we saw was an interesting trend. In those with the lowest blood pressure at baseline, they actually seemed to do worse. But in the highest baseline of blood pressure, they seemed to do a little better. This was not statistically significant. Similarly for the rosuvastatin comparison, we saw those with the highest level of baseline LDL seemed to do better, a visual trend not statistically significant. So we looked at the effect of the combination therapy in those who had the highest systolic blood pressure at baseline and LDL, and saw that there was far less decrease, a statistically significant difference in the decrease in cognitive decline. So the people in the active treatment group scored better. It's worth replication in future studies. Sprint Mind is about to come out, a big hypertension study that carefully looked at outcomes, cognitive outcomes in their population, and those results will be quite exciting. And many studies, both in primary and secondary prevention, are looking at cognitive and functional outcomes now. Navigate ESIS, the COMPASS study. So we're going to see whether certain treatments, novel treatments, anticoagulation in addition to blood pressure lowering and statins, might actually have an effect on cognition and function. We know the association between blood pressure and cognitive decline is actually based on midlife hypertension. So yes, it absolutely makes sense that now we need to go back and look at midlife hypertension, affecting midlife hypertension, and studying long-term outcomes in terms of cognitive decline. But we need to start it earlier, I think.